Hi, all. Good afternoon. Thanks for joining our third episode of our Let's Talk About It Now live series. I'm going to give it a few seconds for people to start joining in while I go ahead and pin this comment. All right. So I'm so excited to be moderating these super important conversations that we have on our live series. We've had some great discussions so far, and I know there's more to come. For those who don't know, I'm Veronica. I'm the social media manager at Now Medical, and this month was Sexual Health Awareness Month, and we're going to end this month with a bang by busting some sexual health myths and misconceptions with the amazing Dr. Devon Price, a sex-positive public research scientist, and our very own lead advanced care technician and GYN specialist, Alexis Perez. All right. Conversation. Accept. Hello.
Hi.
How are you?
Good. How are you? Hi.
Hello. It's nice to see your face.
Yeah, it's nice to see yours too. I went on the page and I was like, oh, I think that's Veronica. Yeah.
Yes. Oh my God. Well, thank you so much for taking this time. I'm so excited to have this conversation. It's such a super important one. I think that, once people understand the myths and misconceptions when it comes to sexual health, they're more empowered to take their sex into their own hands.
Yeah.
All
Cannot
right.
agree more.
I'm just going to go ahead and give the mic over to you so you both can introduce yourselves, starting with your names and your pronouns. All right.
Which of us should start?
Go ahead. Go ahead, Doc. It's all yours.
Hi, my name is Devon, or I'm on Instagram as Dr. Devon P. And my pronouns are she, her. Anything else I should say?
Yeah, just a little bit about yourself, what you do. I did a little bit of an intro, but I'm sure you can do a better one than me.
I guess I'll start with I am a social psychologist by training. I got my PhD in 2018 in social psychology, but I was also in a special program that was funded by the National Institute of Health to look at HIV as a behavioral health problem as well as just not just a biomedical problem. And so all of my research since then has really been applying a lot of the theories that come out of social psychology around stigma and prejudice formation and things like that to the realm of public health and specifically sexual health. And so a lot of my work is trying to destigmatize sexual health care and sexual health services, especially prevention and treatment, and doing so from a lens of trying to destigmatize that process entirely and get more people sort of active in taking control of their sex lives as opposed to sort of feeling victim to sort of different situations. So I currently work for the New York City Department of Health, but I'm also still an active adjunct at Hunter College, and I'm still doing other academic collaborations with colleagues all over the country sort of on these various topics of all falling under the category of sexual health and trying to destigmatize that process.
I love that. Go ahead, Alexis. Your turn.
Hi, my name is Alexis, otherwise known as PA Perez. I'm a physician assistant at Now Medical. I also am lead on the GYN department at Jackson Heights. I'm currently actually trying to implement a sex-positive approach in our clinics. So we would probably be working close together after this. I've been in touch with someone also from Department of Health, and there's a team from Gilead that's working on that with me also. So pretty excited about that.
Amazing.
Awesome. All right, so I guess we could get right into the conversation. I came up with some categories that I think that we can discuss with just some of the more popular, I should say, misconceptions and myths, starting with STIs and contraception, because I think that is just super important. One of the myths that I noticed that are very seen is STIs always cause symptoms. Would you like to talk about that?
So I wanted to make like true and false
Yeah,
cards.
right.
So we should
I
like
know.
hold up true and false.
Right.
But false, false,
Yes.
100% false. I have had, countless patients who will deny, decline that they possibly have STDs or STIs, and lo and behold, sometimes the whole triad of STIs, STDs, so we easily have the conversation, speak to them, talk them through it, treat them, educate them, about what they could do to further prevent. Even sometimes oftentimes offer them to bring their partners in so that
Mm.
they have support in speaking with the partners about it, because obviously no one had symptoms, so they don't know who, when, how, and that's another issue, right? There's a lot of misconception that it must be that partner. No, you didn't have symptoms, so this could have been
Yeah.
this partner, the previous one, the one before that. We don't know. And there's no way to find out unless all of your partners get tested.
Right. And I always tell people too that, kind of like trying to do a visual check or whatever of your partner is that's just not gonna work. Like, yeah, that may catch like the most obvious things, but I say, a lot of us, I'm from Florida, and my sex ed was literally being shown pictures of infected genitals, and we're like,
Wow.
this is what's gonna happen if you have sex, right? And so it was like, it was very much this sort of idea that, okay, STIs are always this like really obvious, really like, sort of like gross and like scary thing. And then in reality, it's like, well, there's like a whole span of this. A lot of people can have them and have absolutely no idea they have them. And then I've also had people sort of say, well, like, what's like what is the big deal sort of thing if I have this infection and like I don't even know about it, like what's the problem? And I also say, well, even if it's asymptomatic, you can definitely give it to someone else and that could definitely become symptomatic for them. But also, if you have a symptomatic, or if even if it's asymptomatic, if you have an infection that your body is trying to fight off, that means that you are more likely to get infected with any virus. Your immune system sort of already battling something. And so that's why a lot of times when people are diagnosed with HIV, there's often also another STI that they didn't know about that was there that can really lower your immune system and, put you at higher risk of actually getting HIV if you're exposed to it. So definitely a big, big
Yeah.
misconception. I also like to mention that like anal and oral STIs absolutely exist. And so I think too, those don't always present in these really obvious symptoms either. Like a lot of us don't even have a visual for what that would necessarily look like. So again, just because you don't have some sort of like really obvious symptom doesn't mean that that's not happening.
Yeah, 100%. I think that people kind of fail to realize that oral and anal is it's still sex. It's still a form of sex. So there's definitely STIs that come along with that. And you also brought me to another good point, the myths surrounding sex education. You said that you came from Florida. Can you just talk a little bit more in depth about that?
Yeah, so my sex education started, well, when I was like in fifth grade. That was the first time we ever had sex education, which I'm shocked that's like
Wow.
in
That's really
Florida, right?
early.
Yeah, and so, but it wasn't like sex education. It was more like they divided the boys and they divided the girls, and they were like, all right, girls, you may start bleeding soon. So it was really trying to like prepare us to get our periods, so to speak, and like sort of
Okay.
prepare. It was more focused on like your body's gonna go through puberty, you know
Like
what I mean?
puberty, yeah.
Yeah, but it wasn't like no one really talked about sex. But then I remember the first time I really had like sex education was it was in high school, and I think I was like in 10th grade, and they had all of us sort of go into this room, and they had this woman come in, and she had this like glittery like chest, and she started this talk by saying her sex education was, even if you've had sex in this room right now, this is like your virginity box. You can put it right back here right now and close it, and you don't have to like, you don't have to do it again. Like it was, and she had this box the whole time. It was like, just, you know, you can definitely like go back to this, just abstinence, you know, and like made it this like very like holy type of thing. And then she said, you know, she started proceeding to like, okay, so this is what happens if you do have sex and you're not married and like all these other things. And it was like, again, like these really infected genitals, like just shown that, like nothing, no discussion about how you could prevent that. No one talked about how you could prevent it, but it was just like really heavy on the scare tactics. It was sort of like, you're gonna get pregnant and you're gonna get like an STI and everyone's gonna think you're dirty and gross. Like it was really heavy on the shame, you know? And so um it was just really awful, and it made me sort of it made me like really feel bad about
Yeah.
having sex for a long time. It definitely made me feel a lot of shame around sex. And I see my friend Alicia, who's an amazing colleague and collaborator too, asked what would you teach in sex ed that isn't being taught now? And I feel like that's a really good segue. I
Yeah.
would really emphasize pleasure, because when I talk about sexual health care and like things like safer sex or STI testing, I always tell people, like, I think that when you talk about sex being safer as like a way to have more pleasurable sex, that's so much like that, like kind of feels better than just purely talking about risk, right? Like instead of being like every time you have sex, like you're at risk of like pregnancy and
Yeah.
for like a virus that will last forever. Like you know, you get all these really dangerous messages about sex, and I feel like that can scare people and shame them enough to the point where they're not willing to, or not, they don't want to prepare or prevent anything because they're so ashamed of it, you know? Like even going in to get tested, you could get shamed by a provider or
Yeah.
something. And so I always think that if we talk about sexual health care and getting tested more from a pleasure-based standpoint, I think more people would really be into it and not feel
100%.
bad, but instead be like, you know what's really hot is like going and knowing that you and your partner both just had a full panel, you're negative for everything, and or you got treated for what you need to be treated for, and now you can have sex without that sort of like, you know, in the back of your mind. Like that's so, in my opinion, that's like an incredible form of foreplay, you know, like this person
Mhm.
just got tested for me. I think that's hot. So
And it's I you know, I also have the discussion of how it's so respectful to yourself and your partner, right? And so
absolutely.
you're kind of starting the relationship on with good foundation, you know, on the right foot.
Absolutely. I think too, like if I was to have a partner and I said, yo, you know, like I'd really feel better if like I'm gonna do it too. This is the thing I always say. I'm like, it's a joint effort. I don't wanna
Mhm.
make, I feel like it can definitely be a weird power thing where you're like, you get tested, I'm good no matter what. Like, you know, we
Yeah.
should have these honest conversations about when is the last time you tested, etc. But yeah, I feel like it's such a, if someone was like, you know, got really mad at me for that or something, or, you know, I know that's why people have told me they don't want to ask their partner to do that. Like, well, what if they don't want to have sex with me anymore? And I'm like, well, if they're not respecting your bodily autonomy
Yeah.
now, what's going to happen when you actually are having sex with them? Like that's maybe a little bit of a red flag, you know?
Yes.
Mhm. Yeah, and that like brings me to your point that you just made me think about like the sex ed that I received in high school, and it was very just like reproductive health, like this is how you make a baby. And then I wish I would have learned more about pleasure, consent. Speaking of, so like consent is a really big one, and I definitely wish that would have been more of a topic, you know?
Yeah, I
I
went
feel
to
like
high
maybe
school. Oh,
Yeah.
sorry. I went to high school in Brooklyn. It was Brooklyn, New York. It was watered down. It was like half a day, half of a period. Like they talked
Yeah.
about nothing.
yeah.
Yeah.
Absolutely nothing.
Veronica,
No.
was yours in New York too?
Upstate New York. Yeah.
Upstate. Okay, okay.
Yeah.
Yeah,
And then it
yeah.
wasn't until I got to like my late teens that I learned the difference between like a vagina and a vulva. And then, oh my God, like your clitoris is like really where it's at.
Whoa. I remember like my mom got me like a book for kids learning about their bodies basically. And I
Mhm.
remember they like had like the vagina on uterus, but there was definitely nothing else, like no sort of like labia, clitoris, anything like that. And I remember when I did finally learn this in like high school, I was like, what? Like this is
Yeah.
fascinating. I had no
I think
idea.
that's important for both men and women to
Absolutely.
learn the
Yeah, we should all
anatomical.
know what's happening.
Yes. And then just speaking about pleasure, so many people have this wrong idea of what sex is supposed to be like. They start watching porn, they get this idea of like, oh my gosh, so this is what sex is like. And then they get into sex, and then maybe they have like pelvic floor dysfunction and they're having painful sex, and they don't realize that that's not even normal.
Hmm. Yeah, absolutely. So
No,
yes,
yeah.
painful sex
Okay.
is not normal.
Painful sex
Painful sex
definitely
is
not
not
It's
normal.
normal.
not normal. You should come speak to one of us.
And unfortunately, I've also had friends who've gone to speak to so many different providers who have told them it's normal. Like, you know, and of course, these are mostly like men who are like old school OBGYNs, you know, who are like really focused on just the baby part of that field, I suppose. But I have had friends who've gone and they're like, no, it's fine. It just does that happens. But no, it's not normal at all, at all.
Yeah. I've read stories of women talking about their providers telling them to just relax, maybe drink a glass of wine. And
Yes, that. I literally haven't heard that advice given before. Like the drinking a glass of wine too. I'm like, why? We shouldn't be telling women they need to get drunk to feel okay to have sex. Like that's like not good. Really bad. I also think
yeah.
the point you made about the porn is good too because it's also like um I think there's sort of a lot of different things that can be assumed. So I think that women too will sort of assume that if they're having sex with men, they should always be able to be like have an erection immediately and keep it for a long time and like you know like if there's any sort of like inability to have that happen the whole time or there's sort of like any type of erectile dysfunction basically like
Mhm.
there's an assumption there's something it's like our fault or like the woman's
The
fault or like
woman's fault,
something
yeah.
about them. And then
Hmm.
I feel like it can really, really like stress out a lot of relationships when in reality it really may be like just straight up a physical and sometimes mental thing. And it's
Yeah,
not about attraction, but like life is stressful or something, you know?
exactly.
And I feel
Exactly.
like if we're not able to like have these like mutually understanding or like empathetic conversations with each other sometimes about our sex lives because we're like you know, almost trying to perform sex rather than
I
have it
was
together.
right. I was just going to
Yeah.
mention that. People don't think of pornography as acting.
Right.
These are actors and actresses. These are scripts. Like there's pauses and and like a movie is put together.
Hmm.
There are special effects that happen, behind the scenes that no one knows about. And so you actually look into it. It's actually pretty interesting the things that, you're setting up certain positions, you're setting up, special effects. Like guys, it's not what it is,
Yeah.
but
Not
it
actually
can
real.
also lead to a lot of disappointment, right? Because
Right.
they're seeing this and they're like, well, that's not happening. Well, I'm a female and I'm not able to, ejaculate like that. Or doesn't my husband last for 3 hours? This porn has been on for 90 minutes. Trust me, there were maybe
Totally.
days in between that.
Yeah,
Totally.
speaking of porn and like the media, then you got songs like the Cardi B and Meg Thee Stallion, like WAP, and people just think that they have to just be gushing out all these fluids. It's super normal. These people are squirting across the rooms in pornography, and that's just another myth that I would really like to talk about because I think that especially vagina owners are getting stigmatized if they're dry and they don't lubricate like these fake pornography scenes.
Yeah, there's a lot of factors as to, regarding a vagina being lubricated, right? There's medication that can decrease lubrication. Of course, there's premenopause, postmenopause, the chemotherapy, stress. Um, the list goes on and on, really, right? But it's not something to be shameful about. We should not be shaming women because their vagina is dry, especially if you're not doing your part to change that.
Yes, it
And this
turns
goes for
out
men and women.
vaginas
But
aren't like penises, and they just immediately like are ready to go. It takes a second sometimes.
yes, yeah, it takes some finesse at times, and even if there is a lot of foreplay and there is building up, and there's plenty of times where it just doesn't happen, and it's okay. There is a huge line of lubrication and all types of stuff that you can use. There's natural stuff, coconut oil, silicone, water, and oil based. I mean, literally the list goes on and on. It's a big industry that is often not spoken about. I've been getting a lot of older women who are complaining of symptoms of atrophic vaginitis, which they don't even know they have, right? Because they've never heard of it, which for the viewers, it's just, the vagina gets dry because there's a decreased estrogen levels after a certain age. And so I'm finding myself educating 60-something-year-old women about their vagina, and it's like, come on, like we have to do better as a society to make women feel comfortable throughout all the phases of their life.
100%.
I think that is so interesting you brought that up, because let's be honest, I love WAP. That is, it was on
I like the
replay for a while, but it really is. Like, I even was thinking, like, I also love Rihanna, and she's got this specific line in one of her songs. Yeah, exactly, that one. And I remember, like, every time I heard that one, I was like, it kind of made me feel a little icky. Like, oh, I don't like that. That makes me like it's like put this hierarchy of, like, we know there's always this hierarchy of attractiveness and, like, desirability and stuff, but it is like adding into that of, like, I am like my pussy stays wet 24/7, and it's just like, this is insane. Like, this is the standard that is just crazy.
Yeah. There's no shame in your lube game.
No,
do not discriminate.
No. And it's so funny you mentioned how many good lubes and, like, different kinds there are, because I think they can be so fun, to, like, play with your partner. And I think you're right, though. Like, I know friends who've been, like, afraid to, like, bring some to their partner because they're afraid their partner's gonna judge them and be like, well, can I not get you, like, wet enough, or, like, yeah.
Yeah, to be honest, that's a red flag. If your partner responds that way whenever you bring out toys that pleasure you,
find another
or
partner.
lubricants that pleasure you, you should find another partner, because your partner should prioritize your pleasure.
Absolutely.
And speaking of toys and speaking of pornography, I think another common myth is the fact that vaginal penetration is the only way you can orgasm, whereas a lot of vagina owners, or most vagina owners, orgasm through clitoral penetration or stimulation.
Absolutely.
And so that's why we got the toys.
Yeah. So right. So toys are something else that's often stigmatized, right? People don't like to speak about them. It's very private. When you order them, they come in, like, concealed packages. Nobody knows. I don't want anybody to know what's in there. And it's like, why are you hiding the fact that you're so open with your body and you're so open to pleasure? That's right. That should not be shameful at all. Like, be proud of yourself. Yeah. It's okay. Have fun. But it's about bringing it to your partner, right? I've had discussions with men who absolutely ban any kind of, penile toys or, phallic toys in the bedroom, because they feel like they're going to be bigger than, what their natural state is, or their partners are going to get used to that, and then they won't be enough for it. And no, it's just a little bit of added fun. It's okay.
Yeah.
Someone left a
And
comment that I had to get rid of a partner who believed toys desensitized the clit.
You
I've
see,
heard that one.
you could educate him on how many neurons, how many nerve endings are there. Like, it's very hard to do that.
yeah.
And if you're feeling a little desensitized, give it a break and go back. She'll come back around.
Yeah, and it's so interesting too because, like you said, I feel like there is like, okay, well, is it a vibrator or is it a dildo? Like, there's like
Right.
now it's like if we get into dildo territory, there's a lot of like, well, why isn't my dick good enough or whatever, you know? And it's
It
like,
does.
oh no. And but it's like the same thing you all are kind of getting at is this idea that, you know, sexual pleasure is just this like penetration exclusively, like vaginal penetration by a penis. And a lot of, there's so many statistics about women who have other women as partners and how much more they have orgasms than women who have men primarily as partners, because there's you know, there obviously we have like certain sexual scripts and certain sexual norms that sort of prioritize men's like explicit sexual pleasure in our sort of dynamics, but there's also like we were all just talking about, we don't teach anyone about our bodies. And so
Yeah.
when you're not telling anybody, and including men, women, everyone, like this is how this person's body is most likely to like experience pleasure, of course like you're going to see these disparities because neither one of us knows, you know, what to do or how to do it. And there's this assumption that like penetrative sex is sort of the gold standard and that's how you should come, like that's how
Yeah.
you should do it, as opposed to like, you know, getting a little, I think there's like this idea of like, okay, you like make out and then you have some foreplay and maybe there's some oral and then you have the penetrative
There is
sex, like
there is totally
that's
a script to, you know, to heterosexual sex or, you know, any other kind of sex. I think there's also a stigma with you know, men that identify as straight. They're not supposed to like any other type of pleasure besides maybe anal and vaginal penetration, and that's not true, right? If your partners are coming to you and want to explore another part of their body or want to explore something else, it's up to you to be open enough to do that. And, you know, if they identify as straight, that doesn't mean they are not experiencing pleasure with, you know, anal penetration or something of the sorts. Why are we shaming men for wanting to experience pleasure? Ladies,
yeah.
the G spot is not actually the penis. Right? So we have to, you know, but if we're not educated about that, and their husband is like, oh, well, can we try this? And oftentimes their wives will look at them or assume, you know, something else, or assume that they may be stepping out of the relationship to go. No, they're probably stepping out because they found someone else that's ready, willing to explore their body the way they would like it to be explored. That's no fault of his or hers or anybody who, you know, is looking for that.
Absolutely. I made this Instagram story just asking people what straight men's sexual liberation looks like, because I feel like I've literally never heard anyone talk about that, you know, because I think we do have, yes, men's sexual pleasure is definitely the priority within our sexual scripts, but like you were literally just saying, it's a very specific version. Like it's like they can only experience sexual pleasure in this like extremely narrow way. It has to be with a partner that's seen as like socially desirably attractive, right? Like they're going to be judged if they're attracted to someone who's not fitting a certain beauty norm. They're going to be judged if they want to have a certain kind of sex. Like so many men love butt stuff. They really do. So many straight men specifically do, and they're really curious about it, but then, you know, they will bring it up to their partners and their partners assume they're gay all of a sudden or that they're bi. And like no, there's nothing related to sexual orientation that has to do with your sexual pleasure. Like that like a certain sexual pleasure or certain sex act like does not necessarily have to relate to someone's sexual orientation.
Right. It doesn't identify who you are or how you identify. Exactly.
Yeah.
At
And I think
all.
that takes us back to like sex ed, because sex ed is such a script where it's just like straight man, straight woman, this is how they have sex. And I think that's where just this whole umbrella of sex is whatever it means to you, it needs
Right.
to kind of be shown in sex ed as well, even especially LGBTQ sex and safe alternatives.
Yeah. You know what? I know it's 5:30. We're like, running the clock, but funny fact. I learned a lot of stuff about sex, obviously not from sex ed in high school, but remember the old lady that used to
I know who you're talking about.
I can't remember her. Is it Susan?
Dr.
Susan?
Sue?
Dr. John? Yes.
Yeah,
Talk sex
right?
with Sue.
She's like an older Jewish woman, right?
She's
Yeah.
like she's like 90 by now.
Yeah, yeah, yeah. I totally know who you're talking about.
Yes, yes. And
Yeah.
I remember watching her like, as younger, and I'm like, this lady must have the best sex life ever. I
Ruth,
gotta listen
Ruth.
to her.
Ruth.
Yes, Ruth.
That's
Ruth.
it. It's Ruth.
Is it
Yes.
Ruth?
Okay.
No, I thought it was Sue. Is it Ruth Johnson?
No, it's
Dr.
Dr.
Ruth?
Ruth.
Dr.
Yeah.
Ruth. Talk
Uh-huh.
sex with Ruth? Something like that, probably.
Something like that. I know her. Yeah.
Yeah.
I
Yeah.
was way too young to be watching that.
I'm pretty sure I was too, but it was on. Gotta learn some way.
Yeah.
I think
Well,
it's good though. It's like I think it's like really important though too, because I have like, I have friends who have little kids now, and they're really intentionally making sure they actually know the names for their body parts. And like a lot of that is coming from a desire to make sure their kids are protected, because a lot of
yeah.
like childhood sexual abuse is like happens because the kids literally do not know that like what's happening to them is wrong. They don't have names for their body parts, and that really does actually put them at higher risk because they're not able to like communicate to the adult that they are being cared for by or whatever, that what's something bad is happening to them, or like they're not able to conceptualize it. So yeah, like even just these discussions about us kind of being like, oh, we didn't know what our body parts even were until like 19 or something, and I just like how many more kids would have been saved by, or like had an adult intervene in something earlier if they were able to actually like communicate what was happening to them, and
Yeah.
also had an adult that told them, listen, like this is not like, no adult should ever touch you without your consent anywhere, and really sort of trying to get the kids to have that level of like bodily autonomy and things. I think you start it early like that, and that absolutely translates into adulthood. You stop being like, feel more in charge of your body and wanting to sort of take control of it and take care of it.
Yeah.
Absolutely.
I've seen kids with the nicknames for, their vagina or their butt, like my cookie, and it's just like, no. No, we want to know what body part you're really talking about.
Yeah.
Absolutely, yeah. I know that's been a big push lately in like parenting world, is to actually teach your kids the real, like I guess medical names is I don't know the right
Yeah,
term.
the medical term, yeah.
The medical term, right? Like the medical term for their body part, that is like
Yeah.
very important.
I totally agree. I've had that conversation with a few parents too. And like you do understand that giving it a nickname opens up the door for a lot of like cute little jabs, right? Like cookie. Can you imagine how many things you can say about your cookie?
Yeah.
Yeah,
Someone took my cookie, like,
someone ate my cookie, so
Oh, no.
like, come on. Like, the poor child is literally talking about cookies now, and she's confused. She's like,
Yeah.
wait, no, not that cookie, the other cookie. No good. You're not doing justice for your children at all.
100%. Well, thank you, ladies, for joining. There were so many gems and so much resourceful information. I feel like it just gives, communities the strength to empower them and have these uncomfortable conversations with their family, their partner, and whoever, in order to normalize this topic and make them not so uncomfortable conversations.
Definitely. Yeah, this was a great conversation. Thanks for reaching out. This was really fun.
Awesome.
No problem. And for those of you who are joining, as you know, sexual health is super important. So Now Medical is here for you, whether it's STI tests, routine checkups. We make your life easier with our healthcare journey. You can easily text your concierge and have them book your STI testing. We have Now on the Go, which will be a service that goes directly to your house to take your blood or whatever STI testing you need in the comfort of your own home. Click the link in our bio to get started. And we look forward to having you all on our next session. We're going to be talking about breast cancer awareness with two amazing women who are breast cancer survivors, and they'll be talking about their own experiences. So I'm super excited for that one as well.
Love that.
Thank you,
Love that. Can't
ladies.
wait for that. Thank you.
No
Thank you so much.
problem. Have a
Bye,
nice night.
everyone.
Bye.
Thank you.